So I think I'll just go ahead and get started and welcoming everybody to our presentation today, Reducing Homelessness for People with Behavioral Health Needs Who Are Leaving Prisons and Jails. This is a project that's a collaboration between the Council on State Government's Justice Center and our team here at the Council on Criminal Justice and Behavioral Health. I just want to say, just welcome everybody to our webinar today as we have the formal launch of this report that we are very excited about and very passionate about, and know that many of you share this passion alongside us and is why you tuned in today. So so appreciate you taking your time out of your busy schedules to spend some time with us. For those of you who had turned into our initial launch on July 14th, just wanted to take a moment just to say a word of appreciation for your understanding as we had to navigate through some of those unfortunate events that led to today's rescheduling. And so really just want to really say that it was such a unfortunate event, but really appreciated the kind notes and calls of support that you all provided afterwards. It meant a lot. And so we're just going onward and upward, and want to thank our IT department at California Correctional Healthcare Services for the support that they've given for helping us prepare for today's meeting. Also want to say some words of appreciation to our panelists. We have an amazing panel lined up today. We have our state leaders, we have folks who are going to be sharing their stories of lived experience with us. We'll have our presentation on our report findings, hearing from San Diego County on housing collaboration and action, and we'll round out the day. I'll do some closing remarks and talk about some next steps. But we just have an amazing group of panelists that have rejoined us today. Unfortunately, Jeff Ross wasn't able to be with us, but he sends his support and his regards. Also want to thank all of you participants for joining in. I know we have folks with lived experience from the healthcare sectors, behavioral health, social services, the justice system, legislators, other state leaders, and local partners. We really can't do this work without you, and so appreciate your participation and interest in the work that we do for the population we serve, which is individuals with behavioral health needs who have become involved in the justice system. And then also appreciation for our state and other system partners in getting the word out for today's presentation. So we have almost 600 registrants again. I think that's about what we had last time, very similar. So it really just shows the interest in this topic and just how everybody is really rallying around this issue. And then also the interviewees who gave their expertise in the development of the report, their expertise is what led to our findings and recommendations. So with CCJBH, a lot of our work began in this housing space with my predecessor, Stephanie Welch, who is now our Deputy Secretary of our Deputy of Behavioral Health at our Health and Human Services Agency. And when she was here, she had started some work working on that developed into a housing first fact sheet and a housing policy brief that came out earlier last year before the pandemic. And that really evolved into a collaborative effort with the Council on State Government's Justice Center for the project that we'll be discussing today, the report that they produced, Reducing Homelessness for People with Behavioral Health Needs Leaving Prisons and Jails. And that work has been funded by the Melville Charitable Trust. So without them, we couldn't be here today. So, that work has really evolved into so much, and it's so timely given the recent significant level of federal and state budget investments to address housing and homelessness, particularly here in California. We focused our July 2021 full council meeting on those budget investments, where we hosted a panel presentation of state leaders who discussed the current funding opportunities and even gave some advice on practical application of those funds. Many of you who are here today, or you'd sent your delegates. And so, if you haven't already, or if you weren't able to tune in, we'll get those meeting minutes posted, so you can take a look and hear what some of that advice was and some of those thoughts that were shared at that meeting. So really with today's meeting, just two takeaways I really want folks to focus on this presentation, or for today's presentations. And that is really how critical it is to address the housing needs for this population of individuals with behavioral health needs who are involved in the justice system. Such a vulnerable population, and the time is now. There's no time like the present, and there's so many stars aligning that can really help get some great work done in this space to really help change and transform the lives of this population and their communities. And then the other thing that I'd really love for people to take away is that, this can be done. The report outlines what needs to be done. And so it's not a matter of like, what do I need to do? Yeah, today's presentation, is really designed to help foster a sense for all of you that this can be done and should be done. And we'll all need your partnership and efforts to really lead all of that work. So without further ado, I know we've got a lot of territory to cover today, so I will introduce my colleague Corinne Buchanan, who's the Assistant Director of Housing and Homelessness at the California Department of Social Services, to say some introductory remarks from her perspective. Oh, actually, sorry, let me see, I just saw the quick notes. Two things, or a few things, presentations being recorded today, so we can provide it to folks who might not have been able to tune in. And that at the end, we'll be taking some questions and comments. So when we do get to that point, we'll ask that folks use the raise hand feature, and then it'll show in the listing for us who needs to be called on, and we will open up the lines for you to be able to announce your name and make your comments. And we just ask that those be kept to a few minutes so that we can get as many people involved or to comment as possible. So without further ado, I'm going to go ahead and turn it over to my esteemed colleague, Corinne Buchanan. So welcome, Corinne.
Thanks so much, Brenda. Hi, folks. I'm Corinne Buchanan, and I serve as the Assistant Director of Housing and Homelessness with the California Department of Social Services. I'm really happy to be with everybody today for the launch of this really important report. I think looking at the intersection of homelessness and the justice system, especially for the behavioral health population, is absolutely necessary if we intend to end homelessness in our state. And it's absolutely integral if we intend to do it with a race equity lens. We know that people who are justice involved are 10 times more likely to become homeless. So my department oversees 7 different state-funded programs to address homelessness that are implemented at the county and tribal level. They're primarily implemented by departments of social services, and they serve families and seniors and people with disabilities. Before joining the state in 2020, I actually worked at the county level in LA with the Office of Diversion and Reentry. And we had the goal of diverting those with the most serious mental health issues and long histories of homelessness away from the criminal justice system and by connecting those people to permanent supportive housing. I'll just quickly share one big lesson that I learned from my time at the Office of Diversion and Reentry. And that's to say that when we started our work, we thought it might be an uphill battle to convince some justice partners that we could safely divert these individuals. And what we found was that actually was not the case. We found that instead, our justice partners were actually really hungry for real and meaningful solutions. Studies again and again find that by providing permanent supportive housing, it not only works to end homelessness, it also saves money. And the systems that benefit the most from those cost savings are the healthcare system, and not surprisingly, the justice system is the other big place where you see those cost savings. I think we can't sit back and just wait for these opportunities to present themselves to us. In this intersectional work, I think 2 key things are that we need homeless services to be coordinated pre-release, and we also need to set up dedicated interim housing settings that can serve folks who are at release and that have a real meaningful path to permanent housing. I think we have a very historic opportunity with new state and federal funding at this moment. Brenda mentioned the stars being aligned. I think you'll hear about this a little bit more from my state colleagues. We have federal resources and new resources from HUD. The state is actually going even bigger by investing $12 billion in funding over the next 2 years across housing and social services and in the health and homeless system of care. That's $12 billion specifically on our work to end homelessness. And then there's also capital funding to help us create new housing settings for individuals experiencing homelessness. So rather than tell you all of the details of each of these new funding streams, though again, you're going to hear a little bit from my colleagues, I'd rather use my time to just give a piece of advice to the justice colleagues that are out there and the housing colleagues that are out there doing this work on the ground at the local level. And that is that now is the time to make friends with the systems that I just mentioned that are going to be administering some of this new homeless funding. Your housing departments and your social services departments and your healthcare and your homeless continuum. And I would say, if you only have time to make one friend, make it your homeless continuum of care, because they administer what's called the coordinated entry system. And that supports access to all of these various homeless resources. And I think it's important to remember that the justice partners in the homeless system actually have the same goals. I think the trick is really making it clear how each partner can mutually support the other in this work. Maybe it's the resources, the cold hard cash. Maybe it's the skills that we can bring, access and a relationship to clients who need these services. And I'll just say that, again, I think now is the time, and I'm really thankful that we have the Council on Criminal Justice and Behavioral Health to help make these connections like the ones that are being made today. So thanks so much. I'll end there, and I am going to pass it to my colleague, Julie Lowe. I'll do that now. Julie, you're up.
Thanks, Corinne. Good afternoon, everyone. My name is Julie Lowe. I serve as the Executive Officer of the Homeless Coordinating and Financing Council, or more easily HCFC. I am again thrilled to be here with my colleagues alongside this panel as the report that we're here to celebrate, the CCJBH report, makes clear criminal justice, behavioral health, and housing systems often serve many of the same people. And I'm grateful for the opportunity to be part of this sorely needed work to break down the silos that hinder our shared work. For those of you who are not as familiar with the HCFC, our role is to serve as the state's Interagency Council on Homelessness. We were created in 2017 to oversee the implementation of housing first policies, guidelines, and regulations to reduce the prevalence and duration of homelessness across the state. I echo Corinne's comments just now about how important it is that housing be a foundation for all people, especially for the population we are focused on. The Council's mission is to develop policies and to identify and coordinate resources, benefits, and services to prevent and end homelessness in our state. Our council is chaired by the Secretary of the Business Consumer Services and Housing Agency. The council is a committee comprising representatives from 10 state departments, including Corinne, along with the appointees from community organizations, individuals appointed by the governor, and people with lived expertise of homelessness. As a team, HCFC is growing, and our staff are charged with an increasing constellation of goals that might be of interest to the folks logged on today. We implement grant programs. To date, many may be familiar with the Homeless Emergency Aid Program, or HEAP, and the Homeless Housing Assistance and Prevention Program, or HAP. We also oversee the development and ongoing management of the Homeless Data Integration System, which is a statewide data warehouse we launched this past April to collect and deduplicate records from our 44 continuums of care, partners across the state that provide information about people seeking services and the services that local jurisdictions provide across California. HCFC also coordinates council activities across state agencies and departments to ensure alignment with council policy priorities and best practices. We work in partnership with continuums of care, federal agencies, city and county governments, nonprofits, housing and service providers, and others. We're also excited for the additional activities stemming from this recent budget. HCFC will be implementing 2 challenge grant projects in the near future. First is implementing a family challenge grant to support our local partners to boost solutions to supporting families at risk or experiencing homelessness. Another new grant program is our encampment challenge grant, which are intended to find new and innovative solutions to resolving unsheltered homelessness across our communities. And finally, I want to share a little bit more about HCFC's action plan for preventing and ending homelessness in California, which the council unanimously approved for adoption this past spring. As many are aware, on any given night, more than 161,000 people are experiencing homelessness in California, representing more than 1/4 of all people experiencing homelessness across the country. Through this action plan, the council pursues a vision for the council and the state's work to prevent and end homelessness that features the state's effort to drive purposeful, meaningful, and measurable progress towards these goals, so that we move towards a future in California where homelessness is rare because it's prevented whenever possible, brief because it's ended quickly whenever it does occur, and with a focus on housing first approaches and housing outcomes, and so that homelessness is a one-time experience ended successfully the first time, so that no Californians experience homelessness repeatedly. Finally, I want to share another activity connected to the action plan that many may find of interest here. The execution of this plan includes the formation of 5 working groups that focus on priorities identified through our extensive stakeholder engagement process. We will be forming a group focused specifically on preventing homelessness among people transitioning back into communities from correction settings. And this will be a group that will be up and running next year. So please stay tuned for more information about the things I shared, and please do sign up for HCFC's newsletter. Our next council meeting is September 21st. We are always really grateful when folks take an interest in our work. Just knowing that, again, so much of our shared success has to do with being in coordination with one another. And with that, I'll pass the mic to Susan Phillip with the California Department of Healthcare Services.
Great, thanks, Julie. Good afternoon, everyone. My name is Susan Phillip, Deputy Director for Healthcare Delivery Systems at the Department of Healthcare Services. Thank you all for having me here today for the launch of this really important report. It's really an honor to be part of this panel. As you all very well know, keeping individuals in stable housing is fundamental to improving the health of our communities. At DHCS, we have launched a major initiative called California Advancing and Innovating Medi-Cal, or CalAIM, as the acronym is called. So CalAIM is a multi-year effort to improve the quality of life and health outcomes of our communities by really implementing broad delivery system, program, and payment reform across the Medi-Cal program. An important goal of CalAIM is to identify individuals based on their circumstances and their healthcare needs and connect them with the services that they need so that we are fundamentally addressing not just the healthcare needs, but the social determinants of health, and really fundamentally addressing the needs of the whole person. So through CalAIM, DHCS is looking to address housing needs in a few different ways, such as offering housing-related services, which includes transition and navigation services and tenancy sustaining supports, and really integrating those services with other needed health and social services. CalAIM also has key components related to justice-involved individuals. As you know, and that's highlighted in the report, individuals often receive both medical and behavioral health services while incarcerated. So upon release from prison, jail, or county juvenile facilities, proper coordination is really needed to help ensure the medical and behavioral health needs of an individual continue to be met. And that time is so critical to preventing homelessness and connecting individuals to those non-clinical needs, such as housing and transportation. So under CalAIM, we will seek to address the needs of justice-involved populations by first providing pre-release enrollment into Medi-Cal. Second, by facilitating referral and linkage to behavioral health services at release. And then providing some in-reach services 90 days prior to release from jails and prisons. In terms of the in-reach services, that does include a new benefit called Enhanced Care Management, or ECM services, and it's a benefit under managed care. And the idea behind ECM is that while individuals are in jail or prisons, we're seeking to identify their healthcare needs and social needs of that individual before they are released, and then working to ensure that individual has that trusted community-based ECM provider to support care management, navigation, and connection to needed services after release. So we have some very ambitious efforts underway, and we're really excited to work with you all. Again, thank you all for having me join you today. And with that, I'm going to turn it over to Jessica.
Hi, everyone. I'm Jessica Fernandez. I'm with the Division of Rehabilitative Programs. I oversee all of the community reentry services for our division. And through the Returning Home Well initiative, we were able to link individuals that were releasing from the institutions, especially during the pandemic, and bridge them to not only substance use disorder treatment and supportive housing services, but we were also able to provide emergency housing, link individuals with with any quarantine and supportive services that were needed upon release, and link them with resources that they were able to leverage within their local community. And we were able to leverage our current provider network that provide wraparound services through our stop contracts, and serve the reentry population in that way. So with that, I'm going to go ahead and turn it back to Brenda.
Thank you, Jessica, and Susan and Julie and Corinne for providing those overviews of kind of from a state level what's happening. So hopefully for folks tuning in today, you can kind of know what who the game players are here at the state level. You know, really a big piece of this is knowing where a lot of this work is happening. So appreciate our state agency leaders coming here today and sharing with us the work that's being done from your various departments, and offering some updates on what folks can be looking out for on as we embark on this current fiscal year. With that, really excited to introduce Katie Herman, who's going to lead us out on stories of individuals with lived experience. So Katie, I will turn.
Thank you, Brenda. So it's my honor, and I'm so excited to introduce our next speakers, Ms. Chi-Chi Lochi and Mr. Marvin Sanders. It is so critical to include the voices and perspectives of people with lived experiences of incarceration and homelessness, housing systems involvement in this work for so many reasons. This type of policy work means nothing if we are not listening to and considering the needs of the individuals who are impacted by this work. They are truly the experts, and I'm so grateful we're able to hear from Chi-Chi and Marvin today. Chi-Chi and Marvin have both participated in reentry services from the Amity Foundation, a nationally recognized nonprofit that offers multiple types of services to people involved in the criminal justice system, which is headquartered in Los Angeles. Chi-Chi is currently living in Los Angeles in her own private apartment. She's working as a disaster services worker for Project Room Key right now, which is excellent. She was incarcerated for 20 years and was released from incarceration in July of 2020, so almost exactly 1 year ago today. Marvin Sanders was released from prison in March of 2019. He currently works for Amity's Transportation Division and is working and driving as we speak, which is a little nerve-wracking, but I trust him. And he has recently bought his own home in Lancaster, California, where he's currently living. So I'll start with you, Chi-Chi. Can you just talk a bit about your experience of incarceration and your transition back into the community? Did you have a housing discharge plan developed before you were released? How did you obtain housing, and how long did it take for you to obtain your housing following your release?
Well, following my release, before I got released, I actually had a plan to go to a reentry program, in which I became a part of the Amity Foundation. Going to Amity, I was there for 6 months, and during the time of COVID, I had to decide where I wanted to go, what section of the city I wanted to be in, and what was the plan after Amity. And that's when I started searching for education, employment, and housing. I became a part of different organizations such as LARP, ARC, and Amity helped me get connected to be a disaster service worker, which works with the homeless community in Los Angeles. Being a disaster service worker, it gave me a lot of information that I needed. And until I had become a part of Southwest College, which I got certified in social work, and I then needed my own place to be. So having education, employment, and the most important element was, where was I going to be? Where was I going to live, so that I could maintain the status of being an asset versus a liability? And it took me approximately until I was released in July, and I got housing in March. And I've been here ever since. And I just want to say thank you to all the people who contributed to me being a recipient of this program, because without it, it would have been quite hard after not being in society for such a long time.
Of course, thank you. And Marvin, what about you? How did you find housing after your release? What was your discharge plan process like following your incarceration?
So for me, it was, can you guys hear me? Okay,
Yes.
so for me, it was, I wasn't actually aware of all the programs and things that were available for me at the moment. At the time that I was released, I was directed through my parole agent, and he had mentioned, you know, the program and all the benefits that could come from it, and just really pushed me towards going into reentry, and gave me something that would bring me from the environment that I came from. It was just a great experience for me. I was able to complete everything that I set in my mind to complete. I was able to get all the tools that were necessary to complete it. It was just a really positive experience to see that all the support and all the funding that was available for me upon release. Had it not been for that, I don't think I would have been able to accomplish what I've accomplished today. So
Right.
I definitely, Amity has played a major role in my success and continues to play a role as we speak.
Great. I mean, Marvin, while you talk about that, you know, you mentioned your parole officer was helpful, Amity. What were some other examples of positive cross-system collaboration, like between, you mentioned parole, Amity, like a landlord, a treatment provider that helped you with your transition? And maybe what were some things that could have gone better in terms of different agencies collaborating to help you when you were, before you were released and when you were released?
I think just information. There wasn't a lot of information available specifically for me that I wasn't aware of all the programs and support that was available at the time. So it was just a matter of being informed and just given the opportunity to actually to be placed in those programs and to have the opportunities to do what I'm doing now.
Great. And Chi-Chi, what about you? Can you think of some examples of positive, like cross-system collaboration, or maybe things that didn't work as well that could be improved?
Yes, I think that, well, first of all, I was a facilitator in CIW and CCWF, and I had the opportunity to be a part of Amity while being there. And so I feel as though, as Ms. Buchanan spoke earlier, that if it's a part of your pre-release, then it makes it easier for everybody involved. I feel as though once you have your parole plans and you know, like 90 days is a great idea for that to begin, that process to begin, you also have people who are willing, like my landlord, willing to allow us a second chance and become active in society as far as having our own space to be. I think that the parole office, the mental health department, the reentry programs, I think all of those people collaborating together and creating a premise for a person that's getting ready to be released gives them choices and options. And so I think that those things are on the positive, because as was said, there's a lot of times that we don't have the resource information until we're out. And so if we could have it before release, that would be wonderful. And especially since they do have counselors and parole probation departments inside the institutions.
Absolutely. That's so well said.
Thank you.
Chi-Chi, what are some of your, you know, along those lines, your recommendations for state policymakers around housing for people involved in the criminal justice system? Like if you could, you know, make changes to certain policies, you know, of course, the importance of pre-release planning, but what are some other examples you can think of based on your experience?
I would also think about ages and what direction the person is going in, because there's a lot of vocational opportunities there, but they don't always match real life. And so I think that if you had individual plans versus a cookie cutter idea, because say for instance with myself, I'm elderly. And so being 64 years old versus being 33, I have a complete different outlook or mindset about what it is I want and how I maintain how to get it. And so after I receive it, now I have to maintain it. And those things can be crossroads as well as for people who are naturally being out here unemployed or coming from an institution.
Yeah, that's so important.
Yes, I would think of those things as being considerations.
Yes, and that's a major piece of this report is, just like you said, not having cookie cutter plans for people. Everyone has very unique needs, and really making sure plans are tailored to everyone's needs, background, and their future plans. And Marvin, what about you? What would be some of your recommendations for state policy changes around housing for this population based on your experience?
I think for me, it would just be the tools that are available. Like I said, it's more or less just the information, just giving more information to the students and to the individuals about what's available. For me, it was the advocates played a major role in my success. The advocate was able to gear me towards what's available for careers, what's available for housing, help come up with like a financial plan and just real life terms, and just being educated on how, you know, to obtain independence and also how to keep the independence, you know, post parole and after you've completed the program. But just information for me is key. It's not enough people know about what's available, or they're just, there's a lot of opportunity that I feel is being missed because of it's not being displayed, you know, in a way that it should. And no fault of anybody, you know, specifically. I just think that educating the population in prison, especially what's available for them, is a key.
Absolutely. Absolutely. Well, thank you both so much. I mean, you're such amazing examples. You know, you haven't been released that long and you're both already working in positions giving back to this same population, which I think is really inspiring. So thank you so much for your time and your perspective. It's so important.
Thank you.
Thank you.
Thank
So
you
now
as
we're
well.
gonna, great, be careful, all of you, but Marvin especially.
Oh no, I'm parked. I'm good now.
Oh, you're parked. Oh, thank God.
Yeah.
Okay. All right. Well, thank you again. I'm
You're
now
welcome.
going to turn it over to Hallie Fader-Tao, Program Director at the Council of State Governments Justice Center, who's going to start sharing some of the recommendations of our report.
Great. Thank you so much, Katie. And thank you so much to Chi-Chi and Marvin for bringing their expertise to today's session. We really, at the Council of State Governments Justice Center, we were really grateful for the invitation from now Deputy Secretary Welch, and the continued partnership of Brenda Graylish and the team at CCJBH in bringing attention to people who live at this intersection between justice, behavioral health, and homeless systems, any one of which are challenging to navigate. And when you think about all of the rules and agencies and funding streams involved, it really does take the sort of collaboration that you see modeled here by the state partners today to think about real solutions at the state policy level, and as we'll hear in a little bit, at the local level. Can I have the next slide, please? So I'm very pleased to be representing the team at the Council of State Governments Justice Center. We're a national nonprofit membership association for all three branches of state government. And the short story on that is that our job is to distill research, analyze numbers, talk with policymakers and involved individuals to provide practical guidance and suggestions and ideas for policymakers. So we were really honored to have the opportunity to work here in California on such a challenging issue that, as I said, brings together three different areas of research, three different policy areas, and many different data sets. Next slide, please. So in order to take what we've learned nationally on what works in terms of policy and practice at this intersection of criminal justice, behavioral health, and homelessness, we wanted to distill what we know nationally, but provide recommendations that make sense in a California context. So in order to do that, we conducted interviews with involved stakeholders at the state level, at the county level. We also, as you heard earlier, talked with people with direct experience and expertise from their own lives coming back from CDCR or from jail and trying to find housing, reconnect with treatment. We also, and I'll turn it over to my colleague in a moment to go through this in more detail, we also tried to pull together data that exists to tell us how big is the population of people we're talking to. $12 billion is a lot of money, it's a big number, and what percentage of that or how many people would you need to serve in order to reduce the risk of homelessness for people who are leaving corrections, either at the state prison or the county jail, who also have behavioral health needs? How many people are we talking about? And then we benefited from the guidance of a steering committee, or an advisory group rather, that represented the same sort of cross-system partnership that we've seen here today. Advisors from CCJBH, the Department of Healthcare Services, Housing and Coordinating Financing Council, Department of Social Services, Katie Howard from the Board of State and Community Corrections, lending guidance about what has been tried in the past and what seem realistic in terms of recommendations for both state and local policymakers who are committed to reducing the number of people who are facing homelessness as they leave jail or prison. Now, we're really excited to be here today. Like I said, my teammates, Thomas is going to tell you a little bit about how we started to put numbers together, and then my teammate Charlie is going to share the recommendations that came out of the report. And we know today is a milestone, but it is definitely not the finish line in terms of this work. So we really see this as a kickoff to be followed by additional training and technical assistance, and we hope additional policy guidance from the state to help local stakeholders really think about how to bring these different resources together and adopt policies that are going to work for people who live at this intersection of different systems. So with that, I'd love to turn it over to Thomas.
Thanks, Hallie. So on the next slide.
We're experiencing a little bit of a lag. I apologize.
Oh, no worries. Thank you. I'll just keep going. So as Hallie mentioned, we've tried to take what public data exists, which is limited and also generally pre-COVID. So couching things in pre-pandemic, and put together some rough estimates of what housing and supportive services are needed across the state from the perspective of folks who are leaving incarceration. That's our population that we're generally talking about. And these data, they include state and local administrative reports and surveys, and generally a bunch of sources that have little standardization in how homelessness is quantified or how it's asked. So, when we're looking at who's coming into jails, we have a large uncertainty about how many people might be experiencing homelessness. And that's due to these factors of a lot of uncertainty and a lot of different ways that questions are asked. And we think that perhaps from 17 up to almost 40% of people in jail may experience homelessness. And to sit with this for just a second, that's so significantly less than 1% of California's population experiences homelessness. And so it's just quite the overrepresentation just in jails alone. And because it's assessed, in various ways and reported up to the state, we know that about 1/3 of folks who are in jail have an open mental health case. If we can get to slide 6, if not, also fine. There we know that we have the, I think on the next slide, actually. Thank you. So the overlap between homelessness and supportive services. What do folks need when they're leaving? So we've made some, again, rough estimates on the overlap of who would benefit from housing first approaches with rental assistance, along with on the left, maybe between 2 and 10% who have a really high level of need of services and long-term rental assistance. So for example, like permanent supportive housing with an ACT team or similar, or on the right, between 8 and 16% of folks who maybe have moderate or low levels of supportive service needs, along with rental assistance. That could be a range of options. And certainly this is not everyone who needs housing assistance or everyone who might have mental health service needs. But this is our best guess with the information that we have from these various reports. And so on the next slide, due to assessments and with summary data that's publicly available, which is fantastic, we have a better sense of the picture of need at the state prison level, particularly for public data for people who are leaving on parole. Similarly, you might notice to what we're seeing at the jail level. And we have a general idea about the number of people with serious mental illness, but there's a lack of public, and I'll stress public, data on this overlap. And the assessment piece is important, as with limited housing and services, we can end up mismatching folks who are leaving jails and prisons, which doesn't lead to success either for people or for the programs, really. And in this sphere, we know that parole's begun working to break down silos by collaborating with both reentry and housing providers, and really excited to see actually some of that work ongoing right now. And so on the next slide, all of these data on housing and supportive service needs, it doesn't exist in a vacuum. And really, this is in the larger context of larger inequalities in multiple systems, including homelessness and criminal justice generally, and in the behavioral health sphere, about who is able to find housing, who ends up in jail, and who actually gets services out in the community. And a lack of public-facing data on the overlap of the three systems, much less getting to these demographic or subpopulation data, it makes budgeting and programming difficult and really serves as a barrier to equity. But now I'll turn it over to my colleague Charlie, who will really take us through these key challenges. Thanks.
All right, thank you so much, Hallie and Thomas. Great to be here with you all today. As we went through our interviews that really formed the foundation of a lot of our work, we were able to, there are a lot of barriers out there that make it difficult for people coming out of prison and jail to access housing. But we were really able to distill these down and group them into 5 key themes. And the first key theme, which we've already touched on today, is silos. Criminal justice, behavioral health, and housing serve a lot of the same people, but there's often not the working relationships or just the mechanisms for people to collaborate, particularly when it comes to discharge planning. And we see this, the way this really shows up in housing is it's difficult to connect people with mainstream housing options coming out of jail or prison. Most typically, this is done through what's called the Continuum of Care Coordinated Entry System, which is a system that's mandated by HUD, where communities or regions locally prioritize people for available homeless housing assistance that's funded by the federal government, which is the majority of homeless assistance that's available in most communities. And so, normally this is accessed through in different ways, whether through a housing and shelter provider, through healthcare providers, but there aren't always the mechanisms to access this directly coming from jail and prison. And because of this and other difficulties connecting with the mainstream housing system, what tends to happen is, completely rationally, the justice system has taken housing into its own hands, and there are sort of more temporary housing options, such as halfway houses, for example, which are really important resources because there's not enough housing and people need somewhere to go. But people aren't always connected with programs that provide them permanent housing, which the research is so clear that that is really what can really break the cycle of homelessness and incarceration. And next slide, please. Thomas really laid the groundwork for this one. Data is another key challenge. We are able to present some estimates to you here on housing and services need, but they are incomplete. The prison data, some of it is only limited to people on parole supervision. Jail data really only represents a handful of jurisdictions around the state. And there are good reasons for that. In particular, in jails, people are tending to be there for a much shorter stay. Staffing resources are more difficult to come by, so it can be difficult to conduct these assessments. But when we don't have a full picture, it's difficult to match people to the housing that is right for them. There are many different housing models out there. It could be a short-term rental subsidy, it could be permanent housing, it could be somewhere in between, and different levels of supportive services. And these can be very expensive investments, so it's important to prioritize them to the people who need them the most. And also, it's hard to advocate for the resources that we all know that we need without being able to paint a picture for policymakers of the full scope of the problem. And so on the next slide, you'll see a couple of our additional challenges: stigma and policy barriers. I don't think it's a surprise to anyone here that people leaving the justice system face widespread discrimination in the housing market. But also, with regard to publicly funded housing providers like public housing authorities, there are commonly a lot of policy barriers in place, the most common being prohibitions on eligibility for people who may have committed a crime some years ago, or maybe only, their offense was only a minor drug or property crime. These things may not have a whole lot of bearing on someone's actual suitability as a tenant. In addition, in the mainstream housing assistance and homeless assistance system, HUD really places a priority on housing people who qualify as chronically homeless, basically who've been homeless for either a certain amount of time or a certain amount of episodes within recent years. And that's an important priority, but because of this federal definition of homelessness, which governs access to a lot of resources, people who have been incarcerated, particularly who have been incarcerated for more than 90 days, are often not able to be prioritized for these resources. And then the final key challenge on the next slide that you'll see is our supply challenge. I'll come back to this point over and over again. You can assess people's needs as carefully as you want. You can connect people with housing as efficiently as you want, but there just is not enough of it. In general, there is only one affordable unit available for every 4 Californians who need it. And so this creates a lot of competition among different vulnerable populations and long waits for really a small pool of units. And so people who are leaving prison and jail are often disadvantaged in this process because they face, additional barriers to housing. So moving on to the next slide, we have a lot of recommendations in this report. There are 10 of them overall. recommendations and action items as well for both state level leaders and county and local level leaders. So what we're going to try to do here in this presentation is to distill them into 3 overall key themes to help us talk them through. The first key theme, no surprise, is data, setting a foundation to connect people with the right housing and to advocate for resources. Access, because it is very important to meet people's immediate housing and service needs and needs for connection to care. And supply, because my favorite talking point, there's just not enough housing. Next slide, please. So key theme number 1, data. Why is this important? It's essential to connect people with the right housing. You know, one person may need a permanently affordable housing unit with a high level of supportive services, what we typically refer to as permanent supportive housing. That can really make the difference for people with complex behavioral health needs, but it's expensive and not everybody needs that. Other people who are leaving prison or jail, they may just need some rental assistance for a short amount of time, or even just assistance finding a unit. So the more data we have, the better that we can, the more efficient and smarter we can be in matching people with these housing and service options. And I think we all know fundamentally that we need more resources, but without painting a picture of what the need actually is, it's really hard to go, say, to the legislature and make the case for more housing resources, or that people leaving incarceration should be prioritized for housing resources. And an additional implication why data is a key theme is you can really see key racial and ethnic disparities. In particular, as Thomas mentioned earlier, you know, Black and Latinx people really face some severe disadvantages. Incarceration rates are much higher, rates of homelessness are higher. And so really to be able to paint that picture helps to target efforts and makes a much stronger case that these investments are just the right thing to do, not only from a public safety perspective, but also from an equity perspective. And so on the next slide, we have some highlights from our action steps of what can be done for this first key theme. A place to start is jails. In California prisons, their homelessness risk assessments are already conducted for the most part. But in jails, this really varies due to the resource limitations that I was talking about earlier. And so a great place to start is to implement just a few basic questions on history of homelessness, housing instability, where people might be going after release, you know, based on examples from other jails, you know, publicly available information. You know, you have to start somewhere. But then for both a jail and the prison population, expanding this into a housing needs assessment. So to be able to better understand what type of housing and services people will need when they get out. You know, we're proposing that this be required for all CDCR releases, but be implemented in a more gradual way for jails. Again, because what most likely will be needed is what's called in-reach funding. So it's actually having the staffing to do these assessments, whether it is somebody on the jail sheriff's department staff itself, or bringing in support from outside agencies. And there are a lot of tools out there that can be adapted to do this work, some of which are already used in some prisons and jails. You just want to really engage community partners, research partners to evaluate these tools carefully, because some of them do have known racial and ethnic biases. And finally, data is no good. Oh, sorry, not quite done. Data is no good if you don't actually report it. But that takes infrastructure and funding. So the state can really support locals here in building shared data infrastructure and creating incentives to actually report this data publicly, including maybe some modest financial incentives. All right, now we can move on. So our second key theme is access to housing. Ultimately, we need to expand supply, but that requires a time frame of many years, a lot of investment, and people do have needs now. And so this key theme really relates to how can we improve access to the housing that's already there and connect people with the services to help them find that housing and to stay stably housed. Next slide. So several action steps here. Thomas alluded to something earlier that I also want to touch on. It's so important to build relationships between different systems to increase access. And as an example of this, we conducted a training last year with regional representatives from the parole department, people from the STOP providers, and continuums of care throughout the state. And this was really valuable in building relationships, kind of getting a baseline understanding out there of the resources that each system had to help connect people to housing. And also just to really do the basic work of, in each region, the parole staff knowing who their COCs are and vice versa. And now teams are really building on that foundation to be able to leverage those relationships and actually make connections to mainstream housing, including coordinated entry. So taking the time to do this relationship building can really pay off, and it's an important first step. But then as you're looking at the coordinated entry system, I want to come back to racial equity again. You want to collect good data on placements. Where are people getting placed? Who is getting placed? You really want to see if there are racial and ethnic disparities in that data, and adjust. Continuums of care have a lot of latitude in how they can prioritize people for housing placements, and also how the referral mechanisms work. So you really want to be collecting that data as you go and be able to make adjustments in real time. Another access strategy is landlord incentives. We see this a lot in the Section 8 Housing Choice Voucher Program in general to try to get more landlords to lease to folks. But actually, it's starting to be piloted in the justice system sphere as well. And these can be, small cash incentives to lease to people leaving incarceration, and then another incentive while they're stably housed. Or it can be what's called a risk mitigation fund, like a local insurance pool that landlords can draw on in the event of damages or people skipping on rent and that sort of thing. Expanding and targeting state funds and rental assistance is always a valuable strategy, building on the foundation of programs such as the adult reentry grants. But that's not going to be enough. An approach that's really shown some results and promise in several cities in California and in other places now is what's called flexible subsidy pools, where usually philanthropic and public investment are combined to create a pool of money that can be used for rental assistance for different special populations, including people leaving the justice system, as well as supportive services. That's a powerful way to really expand connections to existing housing. And there usually includes a component too of helping people locate and stay in housing. And then finally, to bring it back to CalAIM, we're really excited to see the CalAIM proposal moving forward. The transition to enhanced care management helps take a more holistic perspective and looking at social determinants of health, like housing, as part of the overall care package. And then mechanisms such as in lieu of services allow funding to actually pay for services to help people find and stay in housing. So and it's great that there are specific carve-outs for people leaving the justice system in that program. So on the next slide, we have our last key theme, supply. The housing need is significant. And the only way we're ever going to meet those vast needs is through a gradual strategy of expanding supply. There's really not much more to say about it than that. So I'll move to the next slide. So some strategies for doing that. A lot of this work is done at the local level. Criminal justice and housing leaders want to build partnerships with developers who have the mission to want to serve people with justice involvement, and also the capacity. There can be a lot of mutual buy-in, even if people don't want to, say, designate an entire housing development for people leaving the justice system. Maybe they have a mission to serve people with high behavioral health needs and want to set aside some units. It's particularly important, I'll use a phrase that Corinne used earlier, to make friends with these folks, because this is just a time of unprecedented federal and state housing resources. But many of these resources, particularly the federal resources under the American Rescue Plan, are going to be quickly spoken for. And there are already projects in the pipeline. So to be able to make the case to developer partners as well as funding agencies that it's a smart investment to serve people with just involvement, it's important to build those relationships now. And just a couple of other quick strategies to make things more cost effective. California has legislation that prioritizes state and local surplus land for housing development. Anything that can be done to create additional incentives or priorities within that program for the reentry population will really move the needle. Identifying cost savings over time, perhaps from reduced correctional populations, and using that to fund gap financing for housing development. And finally, expanding, there have been some successful developments in California that use what's called the pay for success model, which in a nutshell, basically a government repays a private investor for their investment in housing and support services only if certain outcomes are met, usually housing retention, reduced returns to prison and jail, and that sort of thing. So again, it's important to unlock private resources if we really want to expand the supply in any meaningful way. Next slide. So just a quick glance at all of our recommendations and the challenges they address. If you look at the full report, we move from collaboration, identification of needs and assessment, to connecting people with housing while being able to quantify the needs and make the case for expanded resources. And on the next slide, you'll see our other 5 recommendations. It comes back to this access theme, increasing supportive service resources, connecting people with existing housing, equipping staff to really be able to meet the needs of people with high behavioral health needs and justice involvement. And finally, my favorite talking point again, developing new affordable housing supply. Next slide. So again, these slides will be publicly accessible after this presentation if you want to read our full report. It places all of these issues in more of a national context. You can see all the recommendations with our real nitty-gritty detailed action items for state and local leaders. And all you data nerds can really dig into the methodology that Thomas used to get at some of his housing and service estimates. So I believe that is my final slide. Thank you so much. My email information is in here. Feel free to pop any questions in the chat or email me once my contact information is made available. I would love to talk to you more about our recommendations and what they mean for this important work in California.
Great, thank you, Charlie. As we know, and as a number of people have said already this afternoon, the rubber hits the road in the counties and in the municipalities. And I have the honor of introducing Lahela Maddox to provide a little bit of a local commentary, both in terms of the opportunities she sees with these new investments, as well as some of the challenges. Lahela is the Chief Operating Officer for the Regional Task Force on Homelessness here in San Diego. So that's our local continuum of care. And she not only brings that perspective, but prior to that, she worked in state service with local governments at the Housing Coordinating Financing Council. So I'd like to welcome Lahela here to provide some context from the local level.
Thank you so much. Thank you all so much for having me. As she said, I'm the Chief Operations Officer for RTFH. We are the designated lead agency for the San Diego City and County Continuum of Care. And I'm just really excited to be here and a part of this conversation because, as you've heard many times already, including the continuum of care is critical to this conversation, not just because we're federally mandated and they exist across the country, but really because we focus on the homeless response system. And all of the work that we do is to end homelessness and make it rare, brief, and non-recurring. Next slide, please. As was already mentioned, prior to coming to, next slide again, sorry. Prior to coming to RTFH, I was a director with HCFC. And so I fortunately have had the opportunity to work with all 44 continuums of care in the state of California, as well as most of our large cities who received the HEAP and HAP funding that Julie spoke about earlier. And really the focus is to, not just about funding, but learning about the communities and really supporting the partnerships and collaboration among stakeholders, recognizing that this is going to be critical to the work that we do. My background, and I'll just share a little bit because I think it helps to make the connection of where all these intersections happen. My background is also in direct services. The first half of my career was spent, in our mental health systems, licensing facilities, doing direct services, outreach, counseling, therapy, just that whole gamut in both our mental health system and our justice system. So I have a true, kind of passion for this work and the intersections of all of our systems. And really all of this leads to not just what RTFH believes, but what we personally believe for those of us who work there, that housing is a basic human need and right. Homelessness is solvable. We know that homelessness is an experience and it does not define who a person is. And that all people can be successful in housing with the right supports, and that everyone deserves compassion, respect, and to be treated with dignity. And I just like to always highlight this in presentations when we talk about it, because sometimes we can get caught up, in the data and the numbers and the funding and all of that. But at the end of the day, right, we are all talking about human beings that have been impacted by a variety of systems that oftentimes do not function really well together, but that over the last few years, I think there's really a concentrated effort, to shift that and to really make it, a system that works together as much as possible as we try to work towards ending homelessness for so many people in our system. Next slide, please. So again, RTFH is the designated lead agency of the Continuum of Care for San Diego. We are a 501c3 nonprofit. COCs oftentimes are embedded in government agencies, either at the county or the city, but there are several in the state of California that are nonprofits, and we are one of them. We administer the Homeless Management Information System and the Coordinated Entry System. And in 2018, we also became a direct funder when we were awarded the largest HUD Youth Homeless Demonstration Project funding in the country, as well as receiving the state funding through the Homeless Emergency Aid Program. Also important to recognize is that as the Continuum of Care, we are the strategic planners, and our goal is really regional. We coordinate region-wide efforts. And again, to highlight again the coordinated entry system, it's that system that we use to connect people to the most appropriate permanent housing intervention based on their need. It, of course, includes a standardized assessment process and some prioritization based on that need. And then, of course, a referral to some permanent housing programs. And the COC also has a regional responsibility, which makes us a great partner with the city and the county and some of our other stakeholders in the community to really leverage funding, lead initiatives, and bring in additional partners. Next slide, please. So as we kind of keep hearing and talking about, we end homelessness every day. And now more than ever, I think, again, as you've heard, we really must accelerate these efforts as we have historic levels of funding that we've never had before. And so how do we, embrace all that we've learned from the pandemic to really act with a sense of urgency and to do more of what we know works and continue to reduce the stigma and shame around homelessness by continuing to educate and really remember, again, that at the end of the day, we are talking about human beings who should have housing and should have access to housing. Next slide, please. So the 3 C's that I have always liked to talk about, and it's actually, I think, in the report, and it's something that Stephanie Welch and I, kind of coined long ago when we were talking about the intersection of HCFC and CCJBH. I know acronyms, but so the Homeless Coordinated Financing Council and the Council on Justice and Behavioral Health. And how do we connect reentry and homelessness? And what does that mean? And how do we understand that? And how do we do that? And so when we talk about collaboration and coordination, which is again highlighted in the report, we're really looking at this as the foundation that grounds all of us and leads to commitments, right? Historically, we've been underfunded and we operate in silos. We've shifted that over the last few years, again, now more than ever around the pandemic, and we really need to act upon the financial investments and resources that we have in order to end homelessness. And when we talk about resources, I always like to flag that it's not just financial as well, but it's also our political will, it's our relationship building, which are equally important when we talk about how do we fund these activities. And then lastly, it's simple, right? It's that commitment to doing our part and implementing and moving to action. Sometimes we can get stuck in the conversation and we can have a hard time figuring out how do we move to action. But again, I think we've done a really great job of that over this last year, given all the things that have been, occurring around us. Moving to action has been critical, right? And I think replicating that and continuing with that sense of urgency and that recognition is going to be critical. And really to be effective, we have to know and understand what the role of each of our entities are. And I think, I heard that earlier in the conversation in some folks is that, that education and really understanding how did the system work, who's responsible for what, and ultimately it's all to improve housing outcomes. Next slide, please. So our mantra, right? Housing ends homelessness. Like we know that housing ends homelessness. And as this report highlights, we must meet immediate housing needs, right? We oftentimes will increase our supportive services, but we still don't pair that with a good exit strategy to housing. And as you all know, if we don't have someone housed or in a stable location, it's really hard to serve and connect them to the appropriate resources. And so while we have a lot of great collaborative programs in San Diego, as well as across the state, right? Like intensive care coordination, jail in-reach, coordinated release programs, homeless court. But at the end of the day, all of that still struggles with having exit strategies to housing. In San Diego, our last point in time count, more than 25% self-identified as being homeless prior to being in jail. So again, how do we do a better job as partners to address this? And that's where I'm going to get into the flexible housing pool. Next slide, please. So here in San Diego, we really tried to look at how do we create more doors, knowing that we cannot build our way out. And how do those of you listening today implement a multi-pronged approach to creating more doors? Strategies, obviously, like Project Home Key have been an excellent example in how successful acquisition and rehab can be. And it's also an example of how we can move quickly, but also be really good stewards of our funding. And then another model, again, which we're doing here in San Diego, and it's really been critical to creating more doors, is the flexible housing pool. Again, like many other communities, we really struggle with the available rental housing. So we really wanted to focus on how do we utilize our current rental market, knowing, right, that it can take years sometimes to develop new and affordable supportive housing. So again, this is our three-pronged approach. Next slide, please. Oh, shoot, there's a slide missing. So I'll just tell you what the slide should say, and then I'll get to this slide. But I wanted to talk about, the slide was supposed to have the funding partners and how we funded the flexible housing pool in its first year. And so what we did in San Diego is we used $1.8 million of our HEAP funding, the Homeless Emergency Aid Program. And then we paired that with an investment from the county of their CESH, CESH, their cash dollars. And then we had some private investors as well to really get the model going. And so we invested about $2.2 million in the first year of the flexible housing pool model. We actually started the model back in July last year, shortly after the pandemic started, because we recognized that it would be critical to the exit strategies around the congregate and non-congregate shelters, that it would really be a priority that we ensure that we continue to focus on housing and have exit strategies through the pandemic. So our flexible housing pool model, that's the slide here, it doesn't include a rental subsidy like some of the other models in LA, for example, but we've partnered with organizations that have tenant-based permanent supportive housing or rapid rehousing resources. And so you'll see in this kind of distinction between the two, Brilliant Corners is who we contracted with to operate the flexible housing pool in San Diego. And they are experts and understand that the success of a flexible housing pool depends on a person-centered approach, and they create a portfolio of units that meet an array of housing needs. This also supports us in being able to support a system that has access to housing, to ensure that access to housing is equitable, because Brilliant Corners isn't securing units for a specific person, right? They are securing units for a portfolio that then becomes accessible to our system, right? Historically, we had case managers, social workers looking for one unit for one person. And in the meantime, that one person could potentially pass up, 5 units for whatever reason. With the flexible housing pool, we're taking all of those units off the market as they come across us, and then we put them in a portfolio, and then we connect with a provider to then match folks to that unit. Brilliant Corners are experts in really working with landlord engagement, really helping them to understand the population that we serve, very aware of potential restrictions or needs of who we're trying to serve. And so again, their focus is securing the unit, supporting the landlord, and then providing tenancy support, not supportive services. Those are two different things, but tenancy supports around, like was being mentioned, a landlord mitigation fund, right? Things like that. That's what Brilliant Corners focuses on. And then we pair that with our providers who are providing the rapid rehousing voucher or the support services in order for them to be successful in their housing units. Next slide, please. So just simply some of the benefits, and we have additional information on our website that you can always go to, but the benefit of the flexible housing pool is that we can secure units immediately, and we begin paying the landlord for the unit until a tenant is identified. There's not a lease, there's an agreement between the landlord and Brilliant Corners to secure this unit. And then when a tenant is identified and approved and goes through that process, the lease is then between the tenant and the landlord. It also helps us to secure a large number of units, almost like master leasing in a sense. But again, the leases are not in Brilliant Corners' names. They are all in the tenants' names. We also have a flexible fund as a part of that helps to pay arrears both locally and out of state. And it also has helped them to negotiate lower rate, right? Below fair market rate, and really ultimately reduce barriers in order for us to house more people more quickly. Next slide, please. So these are just some pictures of some of the units that I thought would be helpful for folks to see, and just a couple quick highlights of success stories and how it's worked. For example, we had one young mother who was kind of living in her van and had a child, and she struggled with having arrears. And so they were able to negotiate a reduced amount. We paid the arrears, and then she selected a unit from the portfolio and that she and her daughter were able to move into. And it really broke that chain of generational homelessness. She was homeless as a child, her mother was as well. And so just a really great example. Others have been, again, we've been able to expedite the housing process by just having that relationship with Brilliant Corners. Oftentimes the landlords will waive, extra costs or bad credit or a variety of those other things that are oftentimes barriers for folks that we work with, right? We had another person who secured a unit through the portfolio and felt that it was a unit he could afford. And then once he got there, a couple weeks later, realized that wasn't quite a great choice. So we were able to talk with the landlord and move him out of that unit, put him into another unit. There was no loss of funding, right? No evictions occurred, where typically that might be a situation and someone would just walk away from their unit and now incur expenses, legal fees, evictions, and all of that stuff. So it was a win-win because we are able to maintain that unit in our portfolio fiscally and then communicate with the landlord again in order to come to a resolution that works for everyone. Last slide. I think I have the last slide. It's just my contact information, I think. So I'll just, again, just want to, share that this model, because we believe that it's a viable solution to creating more doors, and it complements the work of all of our partners in our community without causing, right, a competition between our providers. And it's something that we believe could be used. It's used in LA for folks with the justice system and re-entry. And so it's something we want to share on this platform for folks not only in San Diego, but across our state to consider as a solution to meeting short-term housing needs and creating more doors and more opportunities for those that we work with. And that's it.
Thank you so much, Lahela. Amazing presentations. Chi-Chi, Marvin, so helpful for you to share your stories and bring this to life for us, and to the CSG team for walking us through all of the findings and recommendations of the report. Hallie, Charlie, Thomas, Katie, you guys have done an immense amount of work, and I know we still have much more on the horizon. So I want to thank you for that. And Lahela showing us, like, the real world, this can be done, it's being done. So, really all of that, your presentations really brought this to life. Like I was mentioning, lots of work to be done on the horizon. So we here at CCJBH are continuing to work with the CSG Justice Center. We've been working on a fact sheet to see what would it take to meet the immediate needs and long-term needs for our population. So we're just working to finalize that now and hoping to get that out soon, just so everybody can see kind of what's the task at hand. And get a good concept or grasp on that. We're looking to do a fall or a winter, but probably we'll start in the fall and go into the winter webinar series to do a deep dive on the topics, those recommendations that Thomas and Charlie walked us through. Really going deep into, like, what is that system partner collaboration looking like? What are those risk assessments? Just kind of going deep so that folks can get a really good understanding of what those recommendations are and what they entail. We've been into some conversations with California Healthcare Foundation because they've been doing some work in this space as well. So looking to see how we can partner and coordinate our efforts. And then we're looking to do a spring summit to bring our state and local system partners from criminal justice, behavioral health, housing, social services, and other entities together to talk about how to build out this infrastructure locally. And also some of the work from our council meeting in late July. One of the real practical tips of advice that Jeff Ross had provided to us was this notion of doing a pilot study to start getting some successes and growing those throughout our state. So we're looking into the possibility of that as well. So so much work to be done in the months to come. And I think with that, I know we have a little bit of time for some questions and answer, Q&A session. I know we've got some folks who have been putting their questions into our Q&A. I see some hands getting raised. So I was gonna say, for those of you who have put it into the Q&A and you wanna raise your hands, we can maybe catch you there. But if you don't get a chance, I also wanted to encourage folks to put some Q&A in. If you do have some burning questions, just in case we can't get them today, we can follow up with the Q&A, or you can email us and I'll give you our email address at the end of this session. So with that, I'll turn it over to my team to help us moderate some of these questions. So Monica, Paige, I don't know.
So it looks like we have two hands up. We're going to take the first one. We have Simon John. So I'm going to go ahead and unmute Simon. Simon, can you hear us? You'll have to unmute yourself.
There we go.
There you go.
Yeah, so from my standpoint, parole adult program unit, is there going to be any resources that we can get as far as, other programs that may be coming down that we can utilize for our homeless population?
Yeah, I can say from a CCJBH perspective, we worked really closely with the DAPO team and the DRP teams. I know DAPO and DRP are so Division of Adult Parole Operations and Division of Rehabilitative Programs have also worked closely with one another. So I think with a lot of these new resources coming down, I know we at CCJBH are trying to help out in distilling some of that. I know I could give a recent example with the COVID-19 rental assistance dollars that the Department of Housing and Community Development had launched. We were able to connect the housing and community development teams with parole, and I know parole just did a bang up job in getting those referrals done, helping folks get those referrals and those applications submitted for that rental assistance dollars. So so Simon, to your point, we're working as hard and as fast as we can and making sure that we do keep our DAPO and DRP partners involved. And as you see, Jessica was here today as well. So
Thank you very much, and
got
look
it.
forward to any new resources.
Got it, Simon. Thank you. Thanks for joining today.
Here, our next participant is Richard Spiegelman.
Hi, thank you for this informative session and thank you for taking my question. I'm the chair of the Interfaith Coalition for Justice in our jails in Alameda County. And housing and homelessness are things big on our mind. I wanted to ask what in reach 90 days prior to release for a jail would mean for the vast proportion of jail detainees who don't have a clue when they're getting out. Because they're all pretrial almost.
I know, and thank you so much for asking that question. I know Susan had to hop off, Susan Phillip from the Department of Healthcare Services had to hop off. They're in the process, Department of Healthcare Services is in the process of kind of trying to work through those intricacies. You know, the idea is 90 days prior to release. So you have the services that are provided to folks while they are incarcerated, but then you have folks who, as they're going to be coming out. And so you have to kind of know when folks are coming out to know how to do that 90-day pre-release planning. So those are kind of logistical things that are going to need to be worked out. And I see, Hallie, you have a little something to add too.
Yeah, I was just going to say, I think one of the other opportunities here
I see,
is
Hallie, you have a little something to add too.
Can y'all hear? Okay. One of the other opportunities here is bringing the court partners to the table. So it is difficult to anticipate when someone who is being detained pre-trial is going to be released. Judges may not be aware of the importance of having a warm handoff for someone who's leaving jail, even if that leaving is pre-trial. So we're seeing programs around the country explore bringing housing navigators or treatment navigators to the courthouse so that they can connect with people who are being released by the court. But it's also just, you know, another friends to make is collaborating with judges and court administrators to see where there are opportunities to streamline notification so that there is a better chance to catch people who are spending days in jail, you know, fewer than 10 days in jail, nothing close to 90.
Thanks, Holly.
Thank you.
So it looks like just doing a quick time check here, we have time for one more question. And the person here next up is Eduardo Duran.
Yes, excuse me, Agent Duran with the Adult Program Unit. First and foremost, I want to say thank you for the great presentation. And throughout the presentation, one of the main topics that was mentioned is housing. You know, being a field agent for a while now with APU, one of the topics that always beforehand is housing for the participants who are classified as 290s. And for those that have mental health issues, we do have programs, but the majority of the staff are not licensed or can't assist those with mental health issues when it comes to housing or medication monitoring stuff. But the main issue here is housing for the 290s. What kind of resources do you guys have in mind or on plan for this specific population?
Kelly, did you want to answer that, or do you? I got a few thoughts on that, but if I think you look like you might have something to say.
Yeah, I was going to actually kick it over to Charlie and see if he had any thoughts. So for registered sex offenders, this is a notoriously difficult population to find housing for. And I was curious if Charlie or Thomas has seen any trends on that around the country or any promising practices.
I'll say that the trends is difficult. You really, the places that do this the best have really engaged in a long community engagement process. Getting a really mission-driven developer on board, getting to know the neighbors, kind of embarking patiently on public education. That's kind of been the ingredients in the most successful initiatives. But, in terms of a larger scale strategy, I think that is still being very much figured out kind of with those basic principles.
Great. Yeah, I think this is an area where parole expertise is going to come in handy, especially as we build out those partnerships, because I can tell you from other system partners' perspectives, that not all folks are really don't have it on the radar to understand what some of the limitations are for that. So that's going to be, I think, critical expertise to help our system partners work through those to get those in place. So as Monica had mentioned, that was probably our last comment that we could take. We are at time. I don't know, Monica, if you're able to put up our last little slide where we do have these slides posted online, but we were just mentioning that we have our announcements in terms of we have our juvenile justice and our diversion and reentry work group meetings coming up next month in September, and our full council meeting in October at the end of the month. And we are also in September going to be doing a series for Suicide Prevention Awareness Week and Recovery Awareness Month. So please stay tuned for those. If we didn't get to your question today and you didn't get a chance to put it in the Q&A, we have our email address, our ccjbh@cdcr.ca.gov. Please email us your questions to that email address. Also, if you're interested in being added to our listserv, please email your email address. Let us know via your oh, thank you so much, Paige. Here's our email web address. Just email us, let us know you'd like to be added to our listserv. And so just in closing, I just would, love to just challenge our event participants, all participants who joined us today, to really focus on the needs of this vulnerable population, and to reach out across federal and state and local system partners and individuals with lived experience to create new or strengthen existing partnerships. Please just lean on one another, build that trust, be open to learning about one another, and be patient and learn from the mistakes and keep on trying. There's going to be a lot of work to be done, and it's going to require a lot of patience and flexibility. But the health and well-being of this population and our communities really depends on it. And I know so many of you are so committed to this, and just really hoping that you guys take the torch of this report and just keep it moving, and stay tuned with the work that we'll be doing. And we'd love to have your continued participation. So just thank you again to today's panelists and participants for providing such rich subject matter expertise, to the CSG Justice Center and Melville Charitable Trust for your partnership and support. And definitely want to send a shout out to my CCJBH team and our IT team for all the work in making today's event possible. So we'll sign off for now, but we'll be looking forward to continuing our work with all of you in the months and the years to come. So thank you, everybody, for your time.
And Brenda, can I just mention for anybody that didn't get to comment, please send your comment to our inbox, ccjbh@cdcr.ca.gov. Thank you.
Thanks, Monica. Thanks, everybody. Stay well, and we'll look forward to talking to you again.